Hey everybody, we'll go ahead and kick off in just a few minutes, so hang tight, bear with us while everybody gets into the Zoom meeting. Thanks.
Hello, everyone. This is Alfonso Martinez. We're going to be starting in just a couple of minutes. We are setting up we have live interpreters on the line, which you can access. Tenemos intérpretes en vivo aquí. I'm sorry for my Portuguese friends. I don't speak Portuguese. But we're going to be setting that up really quickly. I'm going to be kicking it off shortly. Okay, now we're good to start. Great. So let me quickly, first of all, say thank you for being on this call. Everyone on this call is here for the purposes of wanting to have an impact, wanting to help Latin America fight this very, very sad crisis that we're living through. So seeing so many people on this call, having so many applications and such a demand for this event is incredibly exciting, and and just makes me really, really excited to see the things that will come out of this event. So first of all, my name is Alfonso Martinez. I'm from the Dominican Republic, from Santo Domingo. Here you can see my city behind me. I just graduated from the MBA program at MIT, and I'm part of the organizing team of the MIT COVID-19 Challenge, and specifically of this event, Latin America versus COVID-19. So first thing, I want to thank all of the collaborators that have joined forces with us to make this event a reality. We've had a wealth of support, both from MIT, specifically the MISTI program and the MIT Sloan Latin America office, but also literally over 140 organizations from Latin America that have been excited to join forces with us to help us build this event, to make it a reality. So thank you, thank you, thank you. And we have many of them represented as mentors during the event. So really glad to see many of you here. First thing I want to say is that I want to highlight how in 3 weeks we've seen the essentially interest for this event explode. We had over 4,000 participant applications, over 900 mentor applications. Again, as I was saying, actually over 150 collaborators joining forces and helping us make this happen. And I think very importantly, if not most importantly, we've had an amazing team of organizers, which you participating in the event, you're gonna get to meet them. You're gonna get to meet them as track leads, track support. You're gonna get to meet them via Slack and via Zoom. This event has been a reality because of that volunteering team. So thank you to them as well. We went from 4,000 applications. We're only able to accommodate 1,500, 1,500 applications. So we have a lot of folks participating in this event this weekend. We have 300 mentors and we have 73 countries represented. Almost all countries in Latin America are represented, which was incredibly exciting to see. Now, before we continue, I wanted to talk a bit about where we've come from, what this concept of the MIT COVID-19 challenge has been. We started back in mid-March, literally 3 months ago, with the concept of saying, how can we build a structure that would allow for those individuals that are sitting at home to build solutions towards the most important problems related to this crisis? We said, well, a hackathon could help with that. A hackathon gets people on the same place, in this case virtually, working together to build solutions towards specific problems. So we decided to create this structure called the MIT COVID-19 Challenge. Effectively, a series of virtual hackathons, global hackathons, that would all be focused on the COVID-19 crisis. The first event that we hosted was actually not included in the slide. It was an internal MIT event to make sure that we wanted to test whether or not we could do it virtually. It was called an Ideathon. Then we hosted this Beat the Pandemic round 1 on early April. We had same amount of support, 4,500 applications, 1,500 participants, incredible success. From there, we said, okay, let's repeat this and focus on Africa. We did the same in early May. We did Africa Takes on COVID-19. Then we did a Datathon, smaller, but specifically for data analytics and data science. And that was an incredible success. And finally, just recently at the end of May, we hosted the Beat the Pandemic round 2, which was focused mainly in the US and had incredible success as well. So as our potentially our last event of the series, we decided we needed to focus on Latin America. As a co-organizer of the MIT COVID-19 Challenge, I am personally incredibly excited and humbled that we got the opportunity to do this. And now, as we all know, the need is the highest for solutions to be developed to help with the many problems that Latin America is facing and will be facing over the next few months related to the crisis. So with that, I wanted to introduce our 2 keynote speakers. Today, we're gonna have Professor Roberto Rigobon, professor from the MIT Sloan School of Management, professor of applied economics, who has an incredible charisma, not only at teaching economics, but also at presenting his thoughts about what is really important in life. I'll never forget Professor Rigobon's address to us as graduate students about a month ago, where he explained and he essentially motivated the graduating class on what we should be focusing our efforts on in this near future and how we should tackle this crisis, how we should live through this crisis. So it's an incredible honor to have Professor, well, he doesn't like to be called Professor, so I'll call him Roberto, on the line today to provide a first keynote. Followed by Roberto, we'll have Patricia. I'll introduce Patricia right after Roberto. But with that, Roberto, let me pass it to you.
Well, first, thank you so much. Not even my wife describes me as a charismatic person, but thank you so much, Alfonso, anyway. First, I want to congratulate you for these events. I participated as a mentor in a previous event, and it was really inspiring what all the participants are doing. So I think it's great that we end with Latin America. I think that's is a region that needs it right now the most, and so I think it's very timely that we're doing this. Let me start first. I am from Venezuela, and first and foremost, I know that there are many Latin Americans in this call. As a Venezuelan, I want to actually thank all of your countries, because during the time when Venezuela was having horrible human rights violations in my country, and many of my country people were leaving the country in a state of malnutrition, dehydration. What was truly incredible was how Latin America received all of us. My dad was an Argentinian, and he had to escape Argentina in the 1940s, and he moved from Argentina to Venezuela. My mother was Spanish, and she had to leave Spain right after the Civil War, and she actually left the country with no resources whatsoever. And both of them arrived to Venezuela with nothing. And Venezuela opened their arms to them, and they were able to have a life. And I had a very good life thanks to my parents, but also thanks to the opportunities that my parents got in Venezuela. Venezuela embraced the foreigners at the time, and embraced a complete different culture than what we have today. Venezuela received many Latin Americans at the time when other Latin Americans were having problems. And I have to tell you, the fact that Colombia has received more than 3 million Venezuelans, that Argentina has received more than 800,000 Venezuelans, that Panama has received 500,000 Venezuelans, that Peru, Chile, every country, every single country, Brazil, Spain, every single country in Latin America has received Venezuelans, and more than 5.5 million have left the country. Is really inspiring. So on behalf of all the 32 million Venezuelans that are left suffering, I want to thank all the Latin Americans that are here in this call, because truly the solidarity is truly incredible. So let me talk a little bit about today. When I think about what a crisis like COVID do in general, crises don't tend to change too many things. To be honest, what crises tend to do in general is to accelerate trends. And by the way, they don't necessarily have to be good trends. They just accelerate trends, good and bad ones. And truly, there are very few that have the ability to change paradigms. So I think that COVID is going to be like that. It's going to accelerate many trends that we have before. And we're facing this tremendous challenge today, and it's forcing us to be creative and to innovate. And therefore, when I think about prosperity in the future, the drivers of prosperity are the same ones that I would have actually described a year ago. They're absolutely identical. They're all about technology and management. I mean, if you think about what we're asking you to do in this hackathon is to design or implement technology and management. These are the solutions that COVID will find. The lockdown is a management decision implemented by governments and the private sector, and vaccines are technologies. And so we are going to solve this challenge using what we always use to resolve every challenge that we have, is technology and management. And the key ingredients about this technology and management in particular are aspects like entrepreneurship, data decision-driven processes, and innovation. And what you're going to be doing in these 3 days is to produce exactly that. Data-driven innovation, decision-making, providing advices that could help many, many countries in the world. Particularly in Latin America, we have different problems than other places. First, Latin America was an extremely rich place, and therefore in our culture, we still have those aspirations. It's very difficult for Latin Americans to accept the fact that we are much poorer today, relative terms, than what we were at the end of the 19th century. And in fact, this has been an anchor across all our years of evolution, that it's just very difficult for us to find a balance between the social aspirations and the economic realities. And COVID is challenging that tremendously. I think that we Latin Americans need to learn, and I think COVID will produce that learning. But we need to find a way to produce that balance. Just to give you an example, we have acted in Latin America in the exact same way that developed nations acted in the response of this virus. We put people in lockdown. And to be honest, lockdowns work really well in Switzerland. I mean, in Switzerland, they have 4 poor, and then 4, I mean like 4, that's it. 4 people that are poor. Everybody else is not poor. So, you know, when you put 4 people in that are poor and you put them in a home, it's really easy to find a way to subsidize them and provide relatively good standards of living. There's almost no one that works in the informal sector. And therefore, in a country like Switzerland, doing a lockdown is a no-brainer. In Peru, which I have been working very closely with firms and the government in Peru lately, 70% of the labor force is informal. That means that they earn salaries every single day. How are you going to survive if you don't get a salary? There's a massive amount of poverty. If we put these people in lockdown immediately, they will suffer. Very bad enforcement in general. So unless I am incredibly repressive and I put the military in the streets, there's no way we're going to stop we're not going to enforce a lockdown. And furthermore, we're actually choosing today between 2 forms of death in our region. Either we have contagion, we have an overwhelmed healthcare system, and therefore people will not receive medical attention, and therefore that's what I call an unnecessary death. Or we're going to send people to their home where they have no resources, they have no fridge. 30% of the households in Latin America do not have a refrigerator. I just want you to imagine, how on earth are you going to survive in this COVID if you have to go only once a week to buy food and you don't have a fridge? So the realities are very complicated, because when we put people in lockdown, when we just imitate what the developed nations have done, what we have done is to choose how much starvation, how much domestic violence, how much desperation, mental health issues are we choosing. And therefore, this hackathon is asking you the really difficult questions. It's asking you the questions to solve in a creative way what the world has not been able to do. Is to find how to provide education to a country that, and to a population that is really difficult to provide education. Whatever education gap we had before, which is true in the US, is true everywhere, but it was even more important in Latin America, that gap has become bigger. Okay, so I am very privileged. I live in Boston. I have, you know, a great education system. I live in the suburbs, so I have a great education system. It took only 2 days for that education system to move fully online. Well, you know what? In a rural area, poor area, in the middle of the Midwest in the United States, the kids just went home and received absolutely no education, 0 education whatsoever. So whatever education gap we had, it became bigger. Whatever labor flexibility we had, it became bigger, because I can work from home. In fact, all my co-authors are abroad. So I was already Skyping and Zooming with them. So truly, I mean, this has been no difference. It changed the background. Instead of having books, I have like a green background, whatever is the color of this room. But truly, so it's easy for me to move home. But you know what is really difficult to do from home? Construction. That's a tough one. Plumbers, and that's a difficult one unless you practice on your own plumbing. That's a difficult one to actually do from home. So truly, the lowest skill, the most vulnerable ones, have been extremely and exceedingly affected from this crisis. They have no ability to move home. Their education system got worse. They are denied of healthcare system access, and they have no jobs, have no salaries. You have no way to actually help them in the governments because they are in the informal sector, so I don't have any documentation of salary. They are not bankerized. 40% of the Latin Americans have no banks, etc. So this weekend is about solving the difficult problems of humankind. So first, I want to congratulate you for to tackle those. I think that that's the way that at MIT we think about solving problems. It's a very simple procedure. We find a difficult question, we work on that, we solve it, and then we move to the next one. That's what we hope that you can do in this weekend. We hope that you can produce brilliant ideas that not only are going to be great and you're going to feel proud about them because they're going to be good ideas, but because they have the chance to actually save many, many lives and improve the standards of living of about 600 million people that are waiting for these offers to occur. So I want to thank you for your effort on doing that. I think my 15 minutes are over, so but just let me finish. Let me just finish with a tiny thing about what I think is the true meaning of MIT. MIT, most people say it is the Massachusetts Institute of Technology. That's what we have on the top of the building. But truly, MIT means multidisciplinary, important, and thankless. That's what we do. We do things that are multidisciplinary, extremely important, and we don't expect even to people to say thank you. But I want to say thank you to you, because I know that you're going to do a great job. You're going to actually be able to answer very difficult questions, and you're going to be able to help a region that is desperate for help. So thank you so much for that. Thank you, Alfonso, for the chance to be here, for organizing this. And I hope this is not the last one, my friend. I hope that there are many, many more to come. Thank you.
Wow. Okay, first of all, thank you, Roberto. If that's not charismatic, I don't know what it is. I want to be a participant now. I want to help build solutions. That was great, and that is so. Thank you so much for that keynote. As you mentioned, this might be, and we don't know yet actually, but might be the last one we do in terms of the series of hackathons. But everything and anything that comes out of this hackathon, the reason why we put together these hackathons is for those projects to continue, for those projects to have an impact. And thank you, Roberto, for mentioning that, because I didn't mention that earlier on. Literally the reason why we started this entire initiative of the COVID-19 challenge was to create a structure, not to put together these nice weekend events on Zoom, but to allow for teams and projects to be developed that can have an impact in the short term when we need them. And we've been hyper deliberate about working with the right collaborators. The logos you see on that screen are not just any logos. We were very deliberate about working with the collaborators on the ground that can help teams that are built this weekend actually continue, implement, co-develop, run proof of concepts. This is the goal. It's not only to create a presentation by the end of the weekend, it is to continue with the project. So with that, Roberto, thank you so much.
Thank you.
I wasn't expecting anything else. Okay, so with this, let me continue since we are running on time, right on time actually, with our next keynote speaker. We have Patricia Villela Marino, who is the founding member of the Global Shapers Advisory Board of the World Economic Forum and created the Sao Paulo hub. So she's coming to us from Brazil. She led the creation of the Latin American Platform on Drug Policy, and she is currently she's been the co-founder and president of Humanitas 360 Institute, and the co-founder of Civico, a workspace that brings together civic social entrepreneurs. I am so excited to have Patricia join us today, and very thankful that you're willing to spend some time with us today, because I think you're an incredibly inspirational figure. So with that, Patricia, let me pass it to you. If you could enable your camera and unmute.
Yes.
Yes, we still do not see your camera. Let me see.
The host has asked you. Okay. Okay.
Yes, nice.
What about?
Yes.
It was a message coming up that the host needed to allow myself to enable my camera. So you did. Thank you.
I did. Take it away. Thank you so much.
Well, I feel very honored and thrilled by this invitation, but same time very much nervous to speak after Professor Roberto, because I don't think that I have half of his eloquence and not even half of his capacity to speak to all these students. But I will try my best, and just allow me to be patient because I'm very nervous. And I had to write some notes, so I will make the best use of our times. Let me just be repetitive and say how honored I am to be here, just to be part of this community again. And I wouldn't be neither fair or honest to myself, neither grateful enough to my friends who are attending to this event, if I don't say how much this community, which sustains this very magnificent institute, MIT, means to me, to my home, to my family. It was here at MIT that Ricardo and I, as a newly married couple, spent the 2 foundational years of our lives as husband and wife. It was here that I personally was profoundly tested and shaped on my identity to be who I am today. I was welcomed by the community, especially by the Wives Group and the Women's League that I remember so well. I was welcomed as a human being with not many credentials, but a significant other with no social security number. And you know what I mean, no social security number. Basically a spouse of a brainy student who managed to accomplish his challenge on both sides of the river. And you again know what I mean. A very accomplished person, man, my husband, who took me to MIT. And I'm very grateful for him. It was here that we built our first mutual friendships as a couple. Some of those friendships, they bear fruits, and we are friends and still together. And our sons and daughters are now starting to get to know each other. And we hope that this friendship started at MIT will be a generational friendship. With some other friends, we became family at the point that they have received our son as theirs. With that, I want to say that it is within a community that we are treated, sharpened, and get our character sculptured in the heat by principles and values that shall endure for the rest of our lives. It is within a community that life proclaims its purpose of serving one to another. You are going to be a community for the next couple of days, and hopefully this community will stay forever. Thank you, Professor Higobon, for your eloquency, for your way of keeping people together. Thank you for being this important glue for the members of this community You keep people together, which is a talent and a gift. And thank you for being a Venezuelan who has been a voice and a face for so many other Venezuelans who are voiceless, faceless, and they are so very often losing their lives. I have a very special place in my heart, in my life, in my mind for Venezuela, and for my friends who are still there, as well as for my friends who had, unfortunately, to leave the country. Thank you for Rosabelle and Alfonso for the great service for this community. It is my understanding that because we all belong to a community which does not want to be talking only about diversity, but is ready to address disparity, that we are gathered tonight to kick off an initiative embraced by believers, thinkers, doers, fighters against injustice, inequality, and pain. People who can't stand difference anymore and partiality. Rather, they stand up for accountability and battle against systemic oppression. Guilty definitely is not a strategy for us, for this community, to follow on and to embrace. Rather, responsibility and accountability. It is also my understanding that the primary challenge facing Latin America nowadays is this slowing the spread of the COVID-19. While many nations around the globe are reopening their business and trying to turn the page, we become the epicenter of this disease. Disease that has created a lot of dis-ease to many. The virus is also exposing the kind of inequality that has long plagued our region. Our indigenous communities with limited access to healthcare are being devastated by the disease, and statistics show people with less access to formal education and the Black population from Brazil are 4 times as likely to die from coronavirus than educated people such as myself. In the United Nations this month, there was a warning saying that overcrowded conditions are causing the rapid spread of the coronavirus in Latin American prisons. Let's not forget also that our inmates belong to our population. Beyond its devastating health consequences, this is creating a sense of hopelessness in these communities. And in some cases, it is sparking social unrest and protests, particularly among inmate populations. It is truly a heartbreaking situation. Therefore, I must acknowledge the importance of having this hackathon. The track that you decided about the visibility of the most invisible and marginalized are very, very important. National governments in the region are tackling the problem in different ways. No one knows where to go or which is the right way to tackle this problem. Public healthcare systems throughout Latin America are under tremendous strain. Doctors and nurses, they deserve our unlimited admiration and our prayers. The sheer size and scope of the problem can be overwhelming, but that does not mean that we cannot step up. Take stock of the resources we have and help how we can, and we must. In fact, to do so is our moral and humanitarian imperative. Today, we shall all be ordinary people doing extraordinary things to serve one to another. And this is what I see that's going to be happening in the next couple of days. And that's why I feel myself so honored and humble to be here at this moment. This problem requires massive investments, no doubt about it, and in some cases a change in legislative priorities. But perhaps equally important is an intervention at the grassroots level. And this is my main focus and will be for the rest of my life. Over the next couple of days, it's my hope that you as participants at this event can come up with solutions that will have real and lasting impact on vulnerable individuals and community. In doing so, I hope we can enable the vulnerable communities to better combat this disease and help them to reverse the growing tide of hopelessness into a feeling of control towards what is controllable and faith towards what is not controllable. It is a feeling that can empower, catch on, and grow, multiplying the impact of your work. I speak from the very bottom of my heart, and I speak from my soul. When Ricardo, myself, and Daniel, we founded Humanitas 360, we concentrated on grassroots solutions for the vulnerable and the most invisible people. We are a small organization, but we are very much hopeful that our work can reverberate. One of our primary areas of focus is helping the inmates and former inmates in Brazil, so they can successfully re-enter society. Success in this context means developing with them tools, skills, and the will to become a citizen again, to be part of a society, but to be part of a society in which the system oppresses them all, and the system was not made to receive them back. They need to learn how to support their family, earn a living without going back to their criminal and illegal lives. We have created to do so a model, a business model, a co-op business in penitentiary units of São Paulo, the state of São Paulo, and Maranhão, which is one of the poorest states in the northeast of Brazil. In these state prisons, women learn how to sew high-end textiles while they receive all the information, all the data, the knowledge, the social help that they need to succeed. Once they leave the prison, they are the builders, they are the owners of their own business, which will hopefully, God willing, prevent them from going back to crime. And then lowering the rates of recidivism in the country. Of course, we have adapted our work to these times, to these pandemic times. Today, these women, they are sewing masks and other protective gear to support local healthcare officials. It has been great, and so far, no one of them have gone back to crime. Our effort at Humanitas 360 and Civico, our community of civic social entrepreneurs, go beyond prison walls. And working with, empathically working with civic social entrepreneurs in our journey together, we have seen that homeless population are at increased risk of contracting COVID-19 because they spend time in these areas, in very populated areas, searching for recyclable material to collect and to sell. We developed years ago an app created to maximize the time spent in collecting the recyclable and selling it. Along with the civico-social entrepreneur, Mundano, we developed this app with the help of MIT. And I'm very thankful for Rosabelli again, because under the program that she directs, she sent us programmer, a developer that we needed so much. And together we did the app. Thank you so much again, MIT community. Today, the app has been helping these people to have technology on their mobiles, and they are maximizing their time, and they are still working because they need to work every day to put some food on their tables. They are respecting the social distancing as they are providing the work and the means to survive for their families. Again, as technology management, working to serve one to another, and the community prospering this technology. It's our moral imperative to do whatever we can do to combat the sense of hopelessness. And that's what I believe that you are going to be doing for the next couple of days. This is the purpose, and whatever comes out of it is going to be magnificent. Thank you, and thank you for being these ordinary people doing extraordinary things to serve one to another. This is the call. This is the call for every and each one of us. This is the call that should drive a community such as MIT community. Thank you very much again.
Patricia, I have to say thank you for your incredibly thoughtful keynote and presentation. I mean, equally moved, and I am so happy that we were able to bring you on as part of this overall kickoff event. Thank you for participating.
Alfonso, can I interrupt for a second?
Yeah.
Yes, I also wanted to thank Patricia. I didn't want to say at the beginning, but Patricia's husband, Ricardo, was in the first class. Ricardo Marino was in the first class that I taught at MIT, just graduating. It was a class of only 32, 36 students, and most of them hated me, but somehow Ricardo did not. So I have known Patricia's work through my conversations with Ricardo for a long time, and I know that she has made an incredible difference in Brazil, and I hope that she continues to do the great work that she has been doing. And Patricia, please send a big hug to Ricardo on my behalf. So I was supposed to see him in his birthday actually this year. I was actually traveling to Sao Paulo, and then COVID hit. So it was impossible to see it. So
can Alfonso enable my camera just a little bit? Ricardo is here. He just wants to say hi.
Oh, of course. Yeah. I think you should be able to. There you go.
Professor,
nice.
Oh, Ricardo.
We're all together, part of this community. Very proud to be here, and you've been my first professor. Never forget the good moments, and before, during, and after MIT community. Keep learning with you.
Oh, thank you. So good to see you, my friend. Yeah, next year on your birthday, I'll be there. So COVID will not stop me this time. So I again, have a very successful weekend to all. Thank you, Alfonso, for the practice. I unfortunately will need to drop out because I have to tape classes now. I do have a day job, but I be looking forward to what you produce. And thank you so much, Patricia. You make all Latin Americans really proud with the work that you do.
Thank you.
Thank you. Bye.
Roberto, thank you so much. Patricia, thank you so much.
Thank you very much.
I want to continue with the next portion of our kickoff event. I'm gonna first take a pause again. Sorry. I wanna, give me one quick second. Now it's good. Okay, so I wanna thank our keynotes. Again, amazing, inspiring speeches for us to work throughout this weekend to build things that are meaningful. Wanted to take a moment and mention again, I see we've received many new members to the Kickoff event. We have live interpreters on the line for both Spanish and Portuguese. So if you prefer to listen to this presentation in Spanish or in Portuguese, please, you need on the Zoom on the bottom, you should be able to see a functionality for you to find different lines. We have live interpreters right now on it. Choose the one that works best for you. Also, this entire presentation is being recorded, so it's going to be made available to you and to any members of your team that maybe didn't make it, or any folks that aren't able to make it today. So we're going to have it available. Now, on this next part of the Kickoff event, we're going to have our collaborating partners. So those organizations that we have on this slide, what we did was we asked them, please tell us what problems should we focus on during the weekend? What are the challenges that we should present to everyone this weekend? And this great number of collaborators were incredibly helpful in helping us define where should we focus on this weekend. And that's what we're going to be hearing about today. So we have generally 4 categories. We have supporting the health systems in Latin America, how to protect the most vulnerable populations in Latin America from the direct effects of the crisis, as well as the indirect effects of the crisis. How do we prevent misinformation? And then how do we empower the informal economy, which, as Professor Rigobon mentioned, that is so important, specifically in a region like Latin America. With that, the first track that we have is all these challenges, we're going to have different tracks per challenge. So we're going to have 10 tracks. Each track is going to have a letter. The first track is track A. And that one's part of the group of supporting the health systems, but it's called Identifying the COVID-19 Immune. For that, we have Miguel Paredes from RIMAC Seguros in Peru present that prompt. I'm going to play the video, but before I play the video, I want to say thank you to Miguel. Miguel was one of the first individuals we talked to about the idea of hosting this hackathon, like literally, I think 3 weeks ago. And he became an engine, a train of both promotion and generation of interest for this event. Peru ended up being one of the highest represented countries in from Latin America in the event. And I think in great part, it has to do with Fiorella, which is part of our organizing team, and with Miguel's support. So with that, let me play this. Actually, let me make sure that I'm sharing audio so that you guys all properly hear. Share computer audio. Great.
Good afternoon, and welcome to the MIT COVID-19 Latin America Challenge. We are very excited and grateful that you guys have come together with us this weekend to try to find some solutions for COVID-19 in our region. My name is Miguel Paredes, and I work for Peru's largest insurance company, RIMAC Seguros. I am the Executive Vice President for Artificial Intelligence and Data, and we will be presenting the first track in the COVID-19 Challenge. And we hope that you guys, a lot of you will join in this track and try to find solutions to try to identify and who are the immune COVID-19 people in our populations. Where are they? And also, how do we identify those people who are infected and are maybe unaware of it or are asymptomatic? The best strategy to fight COVID-19 is to identify and isolate, right? And in that sense, we need to come together to develop new and reliable methods to identify, to test, and to trace. This is fundamental if we are to halt the spread of the disease in Latin America and to prevent more and more havoc that is occurring. We need to identify immunity status as well. We need to, in order for people to return safely to the workforce. The virus is affecting our health, But the quarantines and the isolations at homes are also affecting the economies and the livelihoods of many people in our countries. This is really hard. It's not a hard solution to find. So we need you guys to work on this. So what are the new technologies that we can use to achieve these goals? How can we identify, how can we predict the spread in certain locations? The unit of analysis, many times reported by countries, is very aggregate. How do we start getting at a finer grain level, district level, county level? How can we really understand how many infected people are in an area? There's many public data sets of this. And how do we infer and identify people that are potentially infected in those areas so that we can work on trying to test and isolate, and also help. We need to isolate but help those people. The government needs to jump in and try to find ways to prevent them from having to go to the markets or trying to get some money to be able to feed their kids, right? So we need to support them as well. How do we tackle and manage the silent risk of asymptomatic and unaware infected people? This is a very hard problem. Much of the problem here in Latin America, and at least in Peru, has been that a lot of people are asymptomatic, which is common in this with COVID-19 disease patients. And they're spreading the disease, not willingly, not wanting to, but they're just unaware of it. So how do we optimally and intelligently test people throughout Latin America? And this is a very strong challenge for Latin America because there's a scarcity of tests, and we need to find a way of optimally testing. So any insights in trying to identify where we should test and where potentially the asymptomatic and unaware people are would be super helpful. Finally, how can we estimate how many have been infected, where they are, locate them, and try to help them is fundamental for this. So thanks again, and we hope to have many of you guys participate in this challenge. Have a great weekend. Good afternoon.
Okay, great. Thank you so much, Miguel. The next track that we have online is track B, New Ways to Deliver Care in a COVID-19 World. You all will have access to the descriptions of these in your participant guide, as well as on the website. These are posted everywhere. And this content will also be made available to you if you want to review again the videos from our partners explaining these prompts, these challenges. So for track B, we have Valeria Palacios from InterSystems. Let me quickly play.
Hello, everyone. Welcome to LATAM COVID-19 Challenge. I'm Valeria Palacios. I'm from InterSystems Chile, and I'm here to present you track B, which is New Ways to Deliver Care in a COVID-19 World. We already know that pandemics have a huge effect on people's healthcare, and that's beyond the virus itself. People are afraid of getting infected, and that prevents them from going to care facilities and be provided with routinary and essential care, specifically chronic patients. In Latin America, the health systems is normally organized in primary care and hospitals, but the system is quite fragmented, not only in terms of care delivery, but also in terms of information, not to mention the inequality of access between private and public providers. So the question is, how can we provide safer spaces for people that need ongoing care? Think of maternity, think of childbirth and other routinary procedures such as immunizations, vaccinations, and other procedures. We know that telemedicine is a huge example of scalability and safety, but what are the other alternative models that we can harness in order to address this challenge? And above all, how can we use technology to provide safer care for patients? Because population needs safer care and also they deserve it. So this is the invitation and the challenge to address. Thank you and good luck.
Thank you so much, Valeria. Our next track is track C. Here's health systems asset coordination, distribution, and conversion. And for that, oh, perfect. Dr. Amaro is on the line. He's going to be presenting these live. So you want to unmute there.
Yeah.
Perfect.
Classic unmute mistake. Anyway, so people, thank you very much. And that's going to be a huge weekend for everybody. And so my job here is to describe track C and D. So track C is pretty much a follow-up from the previous talk you just heard, but this is more specific. Now what we want is to assess how do you organize your health system, how do you coordinate, how you distribute, and actually the way we think you can approach this problem is by looking at first referral. So what are the rules or what are the means that to make one guy have access to ICU beds in a complex system, especially with the conditions that we live here. In other words, you have a very unequal situation regarding the private and health sector. The second point would be, how would you communicate the needs across this inequality that is pretty well known in Latin America? And although we have healthcare systems organized in different ways in different countries, for instance, in Brazil, we have the largest public/private health system organization, but still, the way it works is far from optimal, especially in those moments. So it would be very interesting to see how do you manage chain supply for medical equipment, PPE, and things related to distributing the resources to where they are needed. First, you have to identify more precisely in real time what are the most needed situations, so vulnerable situations, and then you have to organize the system. So questions like, how do we provide a less hand-on automated way to distribute PPE, as I just mentioned? How can we more effectively and creatively provide new expandable places, flex existing spaces based on active needs, and provide better predictions on upcoming needs? So predictive analytics would be very helpful at this moment, as the cities are now facing the spread of the disease. And actually, this is very interesting. Because we are late incomers in this pandemic, people are suffering from the media for a long time. And now when they need to stay more alert, we are kind of tired. So how do we manage this environment in terms of how can we take advantage of the available data to inform the hospitals and communities how to plan for this apparent disconnection between people being tired of avoiding social contact, again, in a very difficult condition. Some people simply cannot. But how do you manage to work with these antagonistic forces? The fourth question in regard to health system asset coordination would be, how can we retrofit hospitals or spaces such as hotels and other unused spaces to support the non-COVID patients? Because there is this so-called collateral damage. We have this huge wave of patients that should be in a hospital, but they don't have places to go simply because the hospital are filled with patients with COVID-19 sometimes. That's the critical scenario. So people still have problems with other diseases such as heart attacks and strokes. So how to provide a system organization in order to help those people? Again, this should be faced on a kind of emergency situation. So there's no time to build things. So retrofitting is an interesting point. In that regard, I'd just like to perhaps bring something interesting that you should keep in mind. For instance, in the Amazon, the transportation method to deliver those healthcare systems is not by road, it's basically by boats. Actually, that's the most used transport. So keep in mind that also you have an indigenous population in this region of the globe. And in fact, particularly in Brazil, 70 to 80% of those indigenous populations lived in municipal cities that are in critical danger. So they have to be protected in a separate way. So indigenous population would be interesting to take a look at. What else? I think this is pretty much what we mentioned. So basically how to boost communication, how to plan supply chain, and how to retrofit spaces and at the same time take into account the behavior from the population. I don't know, Alfonso, should I move ahead with track D, or would you?
You certainly should. We can just quickly mention it so that we contextualize the conversation, but this track is focused on the healthcare workforce well-being, and generally the overall population well-being. But with that, let me pass it to you, Dr. Amado.
Okay, thanks again, Alfonso. Well, this is, again, I think it's a continuum of problems, but it's well set in the way that healthcare workers are suffering a lot, as we all know, particularly here in Latin America, because of lack of resources, the stressful situation. In fact, we conducted our research here, and it's basically related to how does the access or kind of information is affecting our mental health. So we look at particular psychological symptoms, and in fact, 55% of those health workers present those symptoms. So it's a way to say that information is actually causing some stress. And again, in the sense that we were exposed to information before the virus arrived in our countries. So this is an interesting situation. And in regard to specific questions that you should be addressing, and will be very helpful if you could address those. For instance, how can you organize the hospital to quickly shift or localize, identify better which healthcare workers are in most need to be, for instance, located in particular places. In other words, when you have too much exposure to human suffering, you have actually to balance those things. Sometimes that's just not possible. There's not enough doctors. A very interesting situation we do have in Brazil is that although you might have an ICU working fully operational with all equipments, you don't have medical doctors that are specialized in critical care. And sometimes the doctors that are there, they are not trained enough for emergency situations, which is something that happens to a certain extent in New York, for instance. But here, it's definitely, I would say it's more dramatic. The other thing would be how you would redeploy healthcare workers appropriately in that scenario. So you have to identify the skill sets and where these people are needed, and have to provide the means that they can work where they are most needed. So identify the specific skills. That would be very important. Actually, you have to face a situation in which people are well trained but don't have access to either the equipment or the hospitals in where they are most needed. So we have doctors at home at this point. There's another point which is actually about training these people. So how can you quickly train current or new healthcare workers to fill certain needs in the healthcare system? In other words, this is more about trying to be more specific. So sometimes it's not about numbers. And again, because the countries are large, and so the inequality again kicks in, because sometimes we have a very good hospital in large centers. But again, at the same time, I don't know, a few kilometers away or a few miles away, if you prefer, there's simply not enough resources. So sometimes it's just a question of organizing the healthcare. And last but not least, how do you tackle mental problems or well-being in the whole population? Again, I'll come back to what I mentioned in regard to this stress that we are all faced in, and particularly keep in mind that people in Latin America have been exposed to the dramatic situation of Italy, and only months, or I would say weeks after that we started to see the reality among ourselves. But we've been suffering before. And now, when it's most needed that we should adopt measures that are feasible, we are kind of tired. So it's kind of, we are not in a particular moment that we have this train to keep on moving and going ahead. So we have to think about well-being. So it's a stressful moment in which we should keep the measures up, and we maybe not be possible because of psychological conditions. And just to add a little bit of information in regard to, again, to healthcare workers. If we look at medical residents, in the first year of pediatrics, usually they face a huge stress. It's their first year, and this is a situation in which they are facing human suffering, especially babies. So when we look at their brains, and this is a study that we conducted, we saw that in fact, they consume much more blood and oxygen to solve simple problems. So in regard to all we're talking here, there's even the biological condition that might be interesting to monitor, because that's actually the basis of many chronic conditions. We don't know what's going to be after the pandemics because of the huge amount of stress and burnout that the healthcare workers are suffering. I think that's it for the moment, and I really hope that we can tackle those problems. Thanks again for the opportunity, Alfonso.
No, thank you, Dr. Amado. That was an incredible representation of both of those prompts. I think right on point and with very contextualized data and commentary, though. So thank you for that. In the sake of time, we'll continue with the next track, which is track E, strengthening the supply of public and private goods and the service for the most vulnerable. So now we're gonna talk about a couple of tracks that are focusing now, instead of the health system, focusing on most vulnerable populations. So for that, we have Chris Mejia from the MIT Food and Retail Operations Lab introduce this prompt.
Hello everyone, my name is Chris Mejia. I work for the Center for Transportation and Logistics, and I'm the founder and director of the MIT Food and Retail Operations Lab and also the MIT Scale Latin American Network. So basically we work with logistics, freight transportation, and supply chain management. So first of all, I want to congratulate you all to make it up to here. I'm referring to mentors and also to participants because this is gonna be a tremendous event. At MIT, one of our main principles is actually the betterment of humankind, and that's why we promote a lot the social inclusion. And given the current unprecedented times, we need to make sure that we are making a difference with our lives. And I invite you to do the best also today and in the next 3 days. I'm quite excited to see this hackathon happening because we're gonna be helping the people of our region, our beloved Latin America and the Caribbean. The stream that you're gonna be working on is, in my opinion, extremely important because you're gonna be strengthening the supply of public and private goods to the most vulnerable people. There is plenty of food waste in our region. Without even considering the current pandemic, we were already wasting 1 out of every 3 apples that we produce, just to put you an example. So it's 1/3 of what we are growing or producing. It's a lot. And with the same quantity of food, we can feed around 85% of the people that are living in undernourishment. So just to give you an idea, I'm talking about like 127 million tons of food that are being wasted, and we can feed with that 36 million people. To see these problems in the supply chain is terrible because on the one hand, we have plenty of people suffering, and on the other hand, we are wasting a lot of food. So now with the current pandemic, we see that this problem has been growing even more because the supply chain has been challenged and the traditional approaches have been failing as well because they have been configured to promote cost minimization and also, well, more coverage, but not necessarily to create more social inclusion. So I invite you all to start thinking and reflecting how to change this a little bit. I think that is extremely important because what is gonna come after the pandemic is also, unfortunately, a growing unemployment, and many of the nano, micro, and small businesses probably are gonna go bankrupt, okay? So we need to make a difference on that. So thinking more about how to change these traditional models, I want to give you some hints. On the one hand, we can consider the supply. And for the supply, we need to understand how the current existing models are working, how we can use the commercial landscapes that we have on our hands, the retailing, the wholesaling channels, and also the digital channels, and how we can transform them, okay? In order to provide essential items like personal protection equipment, healthcare services, other type of services, food, and well, many of the different products that we use in a daily basis, okay? Based on that, we need to start considering how to change a little bit the supply chains to be more flexible, more agile, and for example, to divert the food that was going to a specific channel, like food service or restaurants, in order to divert it to other, to end consumers or to food banks that unfortunately are not able to handle the situation right now. On the other hand, something that we need to consider is how to use the social networks. And I'm referring not to the ones that are digital like Facebook, Instagram. No, I'm referring to the ones in real life, where we can find the Boy Scouts or other volunteering groups or even the churches. What we can do through them is to create more coverage, to arrive or to reach out to the most difficult area to access. With that, what I'm aimed you to do is to increase the geographical accessibility, the affordability, and also the availability of those products. But this is only one side of the equation. The other side is the demand. In the demand, we also need to consider that we have to promote education. Education for what? To buy, to eat whatever is in front of us. Because otherwise, without education, we won't be able to cope with this challenge, to deal with this challenge. That's why educating customers and also shopkeepers or shaping their behavior is going to be tremendously important. We need to know how to manage properly perishable products, be more effective developing technology that will allow end users to manage the situation. And we need to start thinking about how to build these technological systems bottom up instead of top down, you know? The ultimate goal at the end is that all the supply chain stakeholders, including also the government and the society, will be able to cope with the current situation, the current COVID-19 crisis, but also we will need to promote more equity all over these processes. So please don't miss the opportunity to give your best during these next 3 days, to be proud of what you're going to be doing, at the end, you're going to be the mastermind behind all of these developments, right? So you will be combating the food malnutrition. You will be providing more opportunities to the most vulnerable people, to the underserved communities. And I invite you all to be extremely active in these next 3 days. So with that in mind, please enjoy the process. I'm quite excited to see this happening, I repeat. And well, I hope to see you all in the final line as a judge, okay? Obrigado, muchas gracias, thank you all. Hello everyone.
Perfect. Thank you so much, Chris. That was really well articulated. Our next track is track F, supporting marginalized communities in confronting the pandemic. For that, we have Rudo Kemper from the Amazon Conservation Team present this prompt for us.
Hi everyone, my name is Rudo Kemper. I'm a geographer and technologist with the Amazon Conservation Team. We are a non-governmental organization that partners with indigenous peoples to protect their ancestral lands and forests. We are very pleased and honored to be participating in MIT's Latin America versus COVID-19 Challenge as a partner organization, and we're focused especially on the challenge of supporting marginalized communities confronting the pandemic. As you probably know, indigenous peoples are among the most marginalized and vulnerable populations in Latin America. Right now, as we speak, the COVID-19 pandemic is spreading rapidly throughout the Amazon rainforest and having a calamitous impact on the health of forest communities. The elders, who are the communal keepers of ancestral traditional knowledge, are passing away at alarming rates. Even the most remote communities are at high risk due to limited access to healthcare and difficulties in keeping out potentially contagious outsiders. The Amazon Conservation Team has been working around the clock to support these communities and protect them from COVID-19. Our actions have ranged from providing humanitarian aid and biosafety materials, spreading awareness about COVID-19 in the native languages, and supporting rapid response grants to community organizations for urgent prevention and care. However, there are still numerous challenges that we still face. Transporting materials to remote areas can be prohibitively expensive. Many of the communities do not have internet or other means to access timely information about the spread of COVID-19 and how to prevent transmission. What's more, the standard guidelines about social distancing are often inconsistent with cultural customs of togetherness, or even impossible to put into practice due to a lack of available space to quarantine in the village, or simply because of the need to work together as a community for basic subsistence. The same, if not similar, challenges exist for Latin America's other marginalized communities, such as inhabitants of dense areas like slums, who also lack access to information and whose livelihood depends on partaking in the informal economy. Like many others, we have been hard at work and feeling overwhelmed trying to tackle these challenges. We have made some smaller advances, like getting started on developing a basic informational smartphone application that can be translated to any language and shared in an offline context. And we're in discussions with local governments to start building a culturally sensitive contact tracing app. But we know that there's so much more that these communities need in these critical times. So we are keen to pose this challenge for the Latin America versus COVID-19 event, focused on supporting these marginalized populations. And I'm really excited and inspired to come together and think about possible solutions with everyone as a team. I encourage everyone to brainstorm widely and openly, because the needs range from something as simple as spreading information and awareness to being able to access resources and services at a distance, to culturally sensitive epidemiological tracing, reporting, and social distancing. Thanks, everyone, and I look forward to working with you.
Thank you so much, Rudo. Great. Okay, so we're gonna move on to our next track, track C, educating in times of the pandemic. So for this, we have Selmira May from UNESCO. She's an education specialist, and let's listen to her presentation.
Hi, everyone, and thank you for the invitation to join this hackathon. I am here representing UNESCO and the education sector of UNESCO Montevideo office, and I wanted to share with you some challenges we have been seeing during this pandemic due to COVID-19. As you may know, most of the schools of the region have closed after the appearance of the first cases of COVID-19 and are still closed. So what we have seen is a difference between countries, among countries, in terms of how rapidly they were able to move to the school education, to the distance learning. And in this sense, well, some countries were better prepared than others, of course. Some countries were able to switch more or less rapidly to distance education and online learning because they had already developed online platforms and resources, and the teachers were more or less used to using these resources, so they were able to continue with the learning process with some difficulties at the very beginning, but then they were able to continue with their plans. However, many other countries were really not prepared in advance, so they have to create ways to reach the students that included several means. Of course, online learning and education through the use of technology was the first choice, but we have to bear in mind that many of the countries of the region do not have an extended reach of the internet countrywide, so that makes difficult for the students and for the teachers, of course, to continue and to utilize online learning as a main means. In addition to that, some students might not have devices of their own that they can use. At the same thing applies to teachers. So some other countries had to rely on other means, like the use of mass media to reach their students through dedicated programs in radio and TV, and in others, and not only a few of them, but considerable part of them had to continue with the use of printed materials to reach those students that were unable to join in other ways. So this of course will widen the inequality of the education systems of the region, and also will make us think in how to improve this in the future. We believe that education through technology will not definitely substitute the school presence, because we still believe that the contact with teachers, with families, and with students is a very important part of the learning process, because it has not only to do with the acquisition of competencies, but also of other skills that are needed for the future.
Great. Thank you so much, Samira. We are now continuing with our next track, track H, surfacing and communicating the COVID-19 truth. So preventing misinformation effectively. And we now have Sandra Sharman from UNESCO as well, who's going to be introducing this prompt.
Hello everybody, my name is Sandra Sharman and I'm representing UNESCO Montevideo's Communication and Information sector. The global COVID-19 pandemic has brought the world to an unprecedented standstill, hitting different countries in different ways and leaving a legacy of critical and long-term implications. According to the World Health Organization, COVID-19 has led to an infodemic, a bombardment of information, both true and false, which makes it hard to know what to trust. In this era of global widespread information sharing, governments across the globe have taken different measures to control and curb the spread of the disease, many using a number of the available digital tools and platforms to communicate and circulate their public health messages. In spite of such efforts, misinformation and disinformation surrounding COVID-19 has become a silent weapon, spreading as fast as the pandemic itself. The power of fake news should not be underestimated. In Latin America and the Caribbean, this phenomenon is increasingly seen as a threat to democracy, public order, and free debate, often causing unnecessary confusion, especially in times of crisis. With the rapid shift in information space, there is so much information out there, as I mentioned earlier. How do we know what to believe? The rapid spread of rumours and false news content surrounding the pandemic has led to expert fact checkers throughout the region to join efforts to scrutinise information, debunk false claims, and produce and share validated information with their communities. UNESCO is an organisation that promotes freedom of expression and access to quality evidence-based information. We're committed to countering misinformation and disinformation in Latin America and throughout the world. We recently launched a series of digital content with recommendations to support people in how to verify content they're receiving during the pandemic. We also released a series of policy papers that also offer recommendations and available in a number of different languages on the subject, and a number of resources throughout the years which you can find by typing in your search engine UNESCO disinformation or going to www.unesco.org, type in disinformation, and you will find lots of information and all the work that we do there available in several languages. Yes, on our site. Good luck and thank you very much.
Awesome. So moving on to our next track, track I, promoting e-commerce and ensuring the continuity of payments in Latin America. And now this two prompts coming up are all related to the informal economy, or generally the economy as a whole, and how it's being impacted by the crisis and how we can help in that. And for that, we have Javier Oda and Luisa Quispe from Credit Corp and BCP, sorry, from Peru. Let me start.
Hi everybody, my name is Javier Oda, and I'm currently working at Banco de Crédito, which belongs to Credit Corp, the largest financial institution in my country, Peru. I'm working as a product owner in Center of Excellence Advanced Analytics, And our mission is to solve different kinds of business problems applying analytics. So the problem that I would like to present today, I think is a huge problem, not only here in Peru, but also in most countries in Latin America, which is informality. What are the consequences of informality? So people who live in informality usually do not have access to health insurance, do not have access to government benefits, and do not have access to a banking system, which means that for these people, it is very difficult to obtain a credit, and that can seriously damage their opportunities. Another consequence of informality is the behavior that we adopt as a society, and one of these behavior is not to trust in electronic payments. So for a common person in Latin America, it's very difficult to buy something on internet or to make a transaction online, just because people don't trust on them. And that happens not only for customers, it happens also for suppliers. There are a lot of informal businesses which only accept cash to receive a payment. So before COVID-19, there was a lot of markets, informal markets around the city, which concentrate a lot of people in a small area. And obviously, in those markets, there was a lot of physical contact.
Hi all. However, when COVID-19 arrived, almost all countries in Latin America had to shut down their doors, including some businesses from small SMEs to big enterprises, unless they provided primary goods or services. So if we see it, we can see that there are two sides involved here that needed to change in order to avoid physical contact: users and providers. Some users did not trust sharing their data or thought they could get stolen if they start using e-commerce, right? But now the situation changed. They had to start using in order to avoid going to crowded places or in order to avoid physical contact. On the other hand, we also have providers, SMEs or big enterprises. However, the problem is more focused on SMEs. Why? Because not all of them have online participation. They may not even have social media or a web page, or even a connection to some service that somehow makes it an e-commerce, right? They had to start doing this process, right? They had to trust, because they needed that in order to generate inflows to pay their workers that may be there, and also to pay the providers. So this quick scenario change has raised one question for an intermediary firm, such as a bank, or maybe a POS provider, or Visa or MasterCard. What is this question? Is the main prompt we have here. That is, how can these intermediary or neutral enterprises can help this change and make it as reliable and as smooth as possible? Why? Because maybe a user that has not bought before in an e-commerce has a terrible first experience. It's very likely that this user is not going to buy again in an e-commerce. He's going to avoid it. So we'll have to put some efforts in order to make this right. Maybe to make a quick refund or something similar. So what can we do with all the technology we have right now and all the this quick reaction we need, right? We want to focus in this neutral point because both users and providers are really important, and they are the core of the whole financial cycle. They are the ones to somehow ensure these payments and ensure also that the cash keeps on running into the economy and generate jobs and reactivate the economy, right? That's the main point we want to address in this prompt. Like what kind of neutral we want to address in this point, and we want to thank you for all your efforts or your ideas shared with us. We really appreciate them, and we wish you good luck.
Our next and final track is being presented also by Luisa, but by another member of BCP, of the Banco de Crédito del Perú. Track J, verifying the use of funds to reactivate the economy. How can we trace those funds? How can we help validate those? Let me allow Nikolai and Luisa to present this.
Hello, my name is Nicolai Huacay. I work at Banco de Crédito del Perú, BCP, part of the Peruvian financial holding Credit Corp. I work in the Advanced Analytics COE team at BCP, where several problems can be addressed through strategies and analytics. The goal is to find an appropriate solution to the problem, even when it may seem easy. In a typical credit process, a client approaches the bank, requests for credit, filling out a form. The information received by the teller then passes into a credit risk approval process, ensuring the fulfillment of the appropriate profile. There are variations of this process that may arise in products with different characteristics, especially for SMEs. There are some that are for working capital, others for buying properties or maybe machines, in a factory, for example. So the terms of the credit process depend on the kind of use the money is intended for. As in any other business, there are risks involved. One of them is the fraud one. We are not exempt of fraud cases, from real defrauders to unintended misissue of the credit. Due to COVID-19, almost all business had to stop working, shutting their doors. This quarantine action includes thousands of SMEs, some of which may be in good conditions and others that were not in such terms.
Hi all, I'm Luisa Quispe. I also work at BCP. Thank you, Nico, for the explanation. As you know, COVID-19 has caused a pause in economics worldwide. So this has also generated one of the biggest recessions of all times. Many countries are trying to inject money into their economy to reactivate it via credit, change in interest rate, favorable to the enterprises and SMEs in the country, are taking similar actions. These actions assume that the credit is going to be used properly. The process, however, is still a credit process, but it makes some guarantees given by the government. For example, the government can put actually money in order to say, okay, I'm the government, I'm gonna bank, you can lend him money because I am the guarantee. If he doesn't pay, I will. The process that is taking place is similar to this one explained, right? So the bank, for the bank, that's still a credit process and it has to go through their usual flows. If the credit is given to the SME, for example, right, how can the bank and the government that is guaranteeing the process, this loan, can be sure that the SME actually invests the money properly in the business and not in other personal issues that it may have, right? So from both points, from the bank point and from the government point, we know that it's important to make certain that this process is done correctly. Why? Because the whole program to reactivate the economy's goal was to generate jobs and make certain that the cash flow in all the country is still running, right? In order to make it, to avoid this recession and try to go further. So this is the main point we address. We want to know how can we detect this misuse of the loans given by the government and by the bank, right? What actions can we learn from a similar program that can be done later, right? That's our main prompt, and we really appreciate all your efforts done in order to resolve it. Good luck in the challenge, and also we'd like to thank our friends in MIT organizing crew that invited us for this challenge. Thank you so much.
Hello.
Thank you so much, Luisa, Nikolai, Javier, the team from Kickoff and BCP. So that concludes our section to introduce the prompts that we're going to be covering this weekend. We have 10 tracks. Each one of you participants have been assigned to a track. You should have access to the Slack channel. You should know who your track leads are. For those in track A, I'm your track lead, and we have other track leads and track teams that are going to help us throughout the weekend. So now I want to take a few minutes, and I'm going to try to do this quick because I really want to move on to our next section of the event, which will be the problem pitches, the 45-second problem pitches that each of you will be, well, whoever has ideas can pitch. I want to first introduce the idea of a hackathon, this Hack 101. So I'll take a couple of minutes to go through that. If you have any questions, by all means, ask it on the Q&A or ask it through Slack to either the organizing team or to your track lead specifically. So quickly, first of all, I wanted to kind of like, if you have hackathon experience, I wanted to highlight that this hackathon is a little different. By the way, all the content that we'll see here related to the Hack 101 is coming from our partners, MIT Hacking Medicine, which is an organization within MIT, a student-led organization that hosts a lot of health-related hackathons and has been crucial to this initiative of the MIT COVID-19 challenge. So this hackathon particularly is different in the sense that it has people from many different backgrounds. In other hackathons, you may see a lot of developers, a lot of software developers, and we do have a lot of software developers as participants, but we have many others. We have a lot, we optimize for diversity. We also have a specific design methodology that we look for you to follow. The gist of it is we look for you to solve real problems, and those prompts that we've presented are real problems. We think of viability. It's not only making a nice app or a nice solution that looks pretty, but rather think about how can you implement that? How can it actually make a difference? How can it have an impact? And then community. How can we emphasize this hackathon, and then the post-hackathon support. It's going to be highly focused on how do we make use of this community that is gathering around how to fight COVID-19 in Latin America. So hacking is not breaking things, but rather applying your ingenuity in a creative way. MIT hackathons are a little different again, or at least this hackathons that we're hosting are a little different in 4 general ways. There is not a strong need for you to develop a lot of code. If you do want to develop code, that's great, but in reality, you don't really have to showcase the proof of concept of your idea or your solution. We optimize for interdisciplinarity. We look for interdisciplinary teams that have multitude of backgrounds represented. Again, back to the problem, I am gonna hammer this down. We look for you to fall in love with the problem that you're solving. You need to think of the problem, not the solution. The solution will be one of them. There will be a solution and can iterate, and it will iterate. But the problem, fall in love with that. Make sure that you understand it completely. And we'll talk more about that in a second. And then again, feasibility. Think of how can you put this solution into practice. So hackathons, what do they used to look like? They used to look like this. This is at the MIT Media Lab in Boston, which is a wonderful space at MIT where you can host hackathons. I actually participated in a hackathon in the Media Lab. Looked like this. It was at night. And it was wonderful. But now our hackathons look like this. And you'll see how exciting it can be as well. Even though we're all from home and working through the computer virtually, it can get really exciting. We'll see. Well, let's talk about the process really quickly. This is a 3-day event. Everything starts today. We have the kickoff. We're gonna wrap up the kickoff shortly. From now, we'll go to open it up for you as participants to pitch a problem that you want to tackle, a specific problem within your track. You'll have 45 seconds to pitch it. It'll get documented and will enable you to interact with others in your track to form teams. We're going to allow you to engage through Slack to form these teams, and these teams will get formed by tomorrow morning. On Saturday, you submit, you register your team, which your team should have no more than 7 people. The minimum it can have is 2 people, obviously, because we need more than 1. But ideally, teams should have between 5 and 7 people. So tomorrow, teams are registered by 10 a.m. You'll get all the details on the specific timing on when you need to submit what later. And it's on the participant guide as well, if you have seen it by now, which you all have received it as participants. But tomorrow it's all based on hacking. Tomorrow is when a lot of the development happens, a lot of the ideation, understanding the problem, developing early versions of the solution, receiving feedback from mentors, iterating on that feedback, doing practice pitches, getting immersed during the day to develop those early proofs of concepts or ideas that can tackle that problem that you want to solve. And then Sunday is going to be focused on finalizing those ideas and presenting them before the judges. So first pitch, you'll see each of you will, after this call, get routed to a specific Zoom room that will be specific to your track. So track A will have our own Zoom room, and each track will have their specific Zoom room. We'll share those over Slack, and those should be also available. It should be available in the participant guide if I'm not wrong. Maybe I am, but you'll have access to those Zoom rooms. We'll kick off the pitches. Everyone will have an opportunity to, if you have an idea, present it before everyone else in the track. That opportunity, that idea will get documented, and everyone else will be able to access it. And once those ideas are documented, not everyone in the track needs to present, but everyone that wants should present, should pitch that problem. Once those are documented, you can engage with the person that presented that idea through Slack. Each idea will be associated to a Slack channel, and it'll be easy for you to form teams through the Slack workspace. This is what I'm describing as the mix. This is where you start getting to know the other people that pitched those ideas that you think are interesting to work on throughout the weekend. And organically, teams will form. If you do need any help forming the teams, let your track leads know. They will be able to, they'll be the best individual to help you figure out which teams are looking for what type of talent or what type of skill set. Then we have hacking. This is what I was mentioning that happens as soon as the team's formed all the way to the final presentations. You need to define the problem, iterate on the solution, find that solution, and build that solution that could have an impact on that problem that you're focusing on. Feedback. Okay, let me stop here for a second. We have, I think, north of 300 mentors this weekend. Make use of the mentors. They are eager to help you. They want to help you. Actually, mentors are pretty energetic when engaging with us as an organizing team. So make use of that energy. Use it to bolster your ideas, to get different perspectives on them. The mentor is not going to be developing the idea on your behalf, nor she or he should. But mentors are a great source of expertise, of fresh ideas, and of an external perspective on your solution, which from personal experience, you can become very focused on your idea and not miss some things when you're like really working on one specific idea. So make use of the mentors and get feedback from them. And then based on that feedback, iterate your solutions. Don't get stuck with what you thought is best. If you're really hearing strong feedback and changing a solution, explore that. Be flexible. Again, fall in love with the problem, not with the solution. And then be ready to present. Be ready to show your best during that final presentation. which we'll have judges for per track at a track level. So quick things that you should do. First, open yourself to crazy ideas. Leave the job titles on the door. We have we optimized for diversity, not only in skill set, but also in age, demographic skill set, demographic diversity as well. So you'll have students. We have about half of the participants are students, about half of the participants are professionals. You have a multitude of different levels of professionals. Leave your job title at the door. Come in with fresh ideas, look for a diverse team, and look to iterate and change your ideas. Allow yourself to get your team to convince you to be wrong. And focus again on the problem. Fall in love with that problem. And obviously, please build something. Not only think through what could work, actually develop solutions. Don't worry about patenting things. Nothing is patent, and we'll cover IP ownership at the very end of this call. But the short of it is that everything that's developed in this hackathon is deemed open source. So don't worry about that. Yeah, don't discuss ownerships. That just burns time unnecessarily at this stage. Make sure your solution is actually specific. One of the worst things that you can do is develop a solution that doesn't solve the problem for anyone specifically. So make sure it's a specific solution. Do not be negative. Don't be shy, please, especially over Zoom. Huh? Be cautious in that over Zoom virtually. Being shy sometimes is easier. So don't be shy. Express yourself and do not monopolize the conversation. A good hack, good story, a real need, meaning the problem, it can be changed, it can be iterated, it can be scaled. Very important, because what we're trying to do here is to trying to get that these projects, these solutions have an impact. So they should be able to be scalable. Again, hackathon process, we talk about the problem a lot here. Identify that problem, break it down, brainstorm it again, iterate on the solution, and go through that cycle. You should do that throughout the weekend, and you should continue to do that after the weekend as well. This quote was a great quote. I didn't choose this quote, but I actually love it. If you only had 1 hour to save the world, I would spend 55 minutes defining the problem and only 5 minutes finding the solution. I think that there's a lot to that, and that goes back to the problem. Really understand that problem. Really fall in love with that problem. Okay, well-defined problems. They are actual pain points. They're quantifiable. They address they can be understood. They can be grasped. And you're able to communicate them and to get buy-in from others that you're communicating them. So those are quick items for you to check. Focus on the 5 whys: who, what, when, where, why. I think these are things that we all are familiar with. Make sure you come back to these and think, okay, who am I focusing on? What am I developing? When does this happen? When is this relevant? Where does it happen? And why is it happening? Again, going back to being quantitative, focus on someone specifically. Not having a specific user, or how some entrepreneurs call it, the customer persona, can be very dangerous. So as you think about your problem, think about who is suffering from this problem and be as specific as possible. Build that persona, and do not confuse the end user with the economic buyer. These are things that you really need to clarify as you want to scale and implement a solution. Team formation. So as I mentioned earlier, right after this call, we're going to go into specific Zoom rooms per track where individuals, not everyone again, usually about 40 to 50% of folks in a track pitch an idea. If you want, you should pitch an idea. If you don't, and you just want to listen to ideas, that's perfectly fine as well. But when ideas are pitched, they'll be documented on a sheet that you'll have access to. Read those ideas, engage through Slack. Each idea will be paired with a Slack channel. So engage through Slack with the individual that pitched the idea, get a feel for what really they're trying to develop, see whether or not there's a need or a match for the type of things that you want to develop, you want to work on, skill set match, and form your teams. Form teams around those unmet needs. Again, we aim to have teams of 5 to 7 people. 7 is the maximum. No team can have more than 7 people, but 2 people on a team is the minimum. So you could have a team under 5. We just believe, and data suggests that teams with 5 to 7 are optimal. So now covering quickly the judging criteria. At the end of the weekend, every team will present before judges, and judges will use this rubric to assess who should be a winner in a given track. And we focus on 4 things. The first one, and I honestly think the most important one, is impact. How much impact can this solution have? If it would be scaled and implemented, how impactful can it be? How innovative is it? Are you just repeating something from somewhere else, or are you applying some, where is the innovation? I guess it's a good way to think through the innovation criteria. The implementation, again, for you to have impact, you need to be able to implement whatever you develop. And this event is meant to foster projects, foster solutions that can be implemented. So think about implementation very carefully. And then the presentation is also something we think about. How do you communicate your idea? Quickly, code of conduct is something that I referred to earlier. This is something that all participants have agreed to by now when you RSVP'd. All events within the MIT COVID-19 challenge follow a similar IP, like intellectual property and ownership clause, where effectively what this says is that all the developments within this weekend are open source. The reason being is that we do not want to have any friction between the development of solutions and having those teams implementing the solutions with some of our collaborators during the post-hack support. The other item that I want to make sure I cover today is this photo release. We'll be taking screenshots from time to time during the Zoom rooms, like during the Zoom meetings, so that we can use those for promotions in the future and to feature in the event in the future. Also, these sessions are recorded, as well as the problem pitches, the final presentations, the award ceremony. These sessions will be recorded. So if you have any issues with being potentially recorded or captured in any of these videos or images, please let us know to the COVID-19 Latam at MIT.edu email. And last but not least, social media. Let's promote it. We have the Instagram, we've got the LinkedIn, we've got the Twitter, we have a hashtag you can use in any of these social channels. Please do post, mention, spread the word, not only about the event, and actually more importantly, about the solutions that come out of the event. This is meant to be a channel that allows those solutions that are most promising out of this event or this set of events that we've hosted to be propelled and to actually be deployed and have an impact post the event. Okay, quickly, weekend agenda. And here I'm gonna ask my teammates to also help me cover anything that I do not cover. So please, Anna, Fiorella, Catherine, anyone else as a panelist on this webinar, please chime in if I miss anything. But very quickly, I covered this at a high level earlier, but we have 3 phases of this event. Today, we're ideating, tomorrow solving, Sunday we're pitching. Today, we're having the problem pitches and the team formation. Those are the 2 things that are happening. It'll be a little chaotic. It'll be a little like you're gonna feel a little like it feels a little crazy. That's okay. That's normal. That's how it should feel. We have 1,500 people participating in this event, and it's all virtual, which is fine. Teams will be formed. So listen to the pitches, pitch your own pitches, form your teams. Then tomorrow we'll try to help you. Not only while you're hacking, we'll also have other programming. Specifically, we have two items that I want to highlight. One is a how to pitch session. We have David Beckett, who's a renowned pitch coach, who is presenting for us tomorrow. He has a recording of his presentation with subtitles in English, in Spanish and Portuguese. So we won't have live translation for him tomorrow, but his presentation already has translated subtitles. I would definitely recommend watching him. I loved his structure, and I think it'll be very, 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 very helpful for everyone in the event. And then in the afternoon, so that happens at 1 p.m. Tomorrow Eastern time. In the afternoon, we'll have practice pitches from 6 p.m. to 9 p.m. Eastern time. This is when this acts as a forcing function for teams to have something ready by 6 p.m., by 7 p.m., and present that before mentors and get that external perspective, external feedback on their presentation, on the delivery of their message, and the content of their solution. And I actually got to say that those practice presentations, I think, are pivotal moments for teams in learning what they're missing and leapfrogging the quality of their solutions and their presentations. And then on Sunday, we have more practice pitches, and then we have the final presentations followed by the award ceremony. So with that, as I mentioned, we are on time. We planned it so that we could have a couple of minutes between transitioning from this Zoom room to the next Zoom rooms by track. So problem pitches will kick off at 9:15 Eastern time. So that's exactly 15 minutes from now. Please join those, as that's where you'll see what problems will be pitched within your track. And from there, teams will be formed. With that, let me stop for a second and ask if for anyone from our team, from Anna, Fiorella, Catherine, are we missing anything?
No, I think we're good. Those are the main things, Alfonso.
Okay, awesome. Thank you so much. Finally, the last thing I'll highlight before I let everyone go to their respective track problem pitch Zoom rooms. I want to highlight the participant guide. The team has done an amazing job at putting together this very comprehensive participant guide in English, Spanish, and Portuguese. It has everything that you need to, essentially to participate in the event. It's captured in these documents. You should have access to these documents. If you don't, again, ask your track leads for the link to these documents, but I'll ask you to please review them in detail. Please review the hackathon resources that we have. We have these amazing partners offering cloud credits, offering access to their databases, offering a bunch of tools that you can use as a team to build your solutions. I would really recommend, we have a lot of hackathon resources. Review those in detail, engage with those organizations, those partners, because they are very excited to engaging with you. Great. So with that, if we don't have anything else to cover, I'll wrap up this section of the event. I'll say again, thank you for participating. Thank you for being here. This is positioned to be an incredibly impactful weekend for our countries. I'm incredibly excited to see the type of solutions that come out, the type of projects that come out of this weekend. I'm really looking forward to the final presentations. And with that, I'm gonna allow you to get back to your, we're going to close out this session, and we're going to now move on to our specific track Zoom rooms for problem pitches. Thank you, everyone.